Good morning, your Celebration Radio Network.
Yeah, hi. Bill, this is Doc Sinatra.
Yes, good morning.
Good morning.
How are you today?
I'm good. And Bill, where are you, by the way?
I'm in
Florida.
You're in Florida? I'm
Yeah.
in Lake Havasu City, Arizona.
Oh, my gosh. Oh,
Yeah.
it's early there. I'm so sorry. Oh, gee.
Well, it's a little warm, but it's
Yeah.
not too bad.
Good.
Well, I should say a little warm. It's, going to be 108 today, so that's for us a little warm.
Well, that's good news because I don't think the virus will live in those type of temperatures,
Yeah, that's what I've been hearing. So you are part of the American Nutrition Association?
Yeah, I've been on the board of directors for years.
Well, your background's in cardiology.
Yes.
Obviously, your eating habits and exercise and all of that play a part in heart health.
Yeah.
I've had 2 heart attacks myself.
Oh, dear.
I had a stent put in my right coronary artery that blocked within a year, and they have not done anything about it. Now, this was almost 19 years ago now. So what, and I have these weird, it's not really pain, it's kind of like it goes across my chest when I have activity, and it feels like my nerves are on fire. I do have fibromyalgia, so I'm kind of wondering if with the activity, it feels like a pressure, but it's different. It's nothing I've ever experienced before.
Yeah.
Being 53 now and had my first heart attack when I was 34. So I was always active. I was an athlete. I ran 3 to 5 miles a day, lifted weights. I played football for almost 20 years. And then all of a sudden I get hit with this, heart attack, and it kind of put a kibosh on a lot of things.
You got to have a genetic weakness or a weakness somewhere in your blood lipids or what. There has to be something going on.
It is genetic. Runs
in the family?
Yeah, on both sides. So my dad
Did you ever
had
have your LP little a assessed?
My what?
It's called lipoprotein little a. LP, capital L, small p, parentheses, little a.
No, I don't think I have.
You should have that assessed because when I hear somebody with a young occurrence, age 34, with a positive family history, that's my first go-to risk factor. The problem, see, you don't hear about this because there's really no drugs that can neutralize it. I mean, there are natural things like nattokinase, urokinase. I mean, things that you can get to help, neutralize the risk factor. But as far as pharmaceutical drugs, nothing really helps. I mean, niacin helps, but that's not really a pharmaceutical drug. But make sure your doctor looks at your LP little a because that's one risk factor I worry about. And it runs in families. It's genetic, and it's even more common today than it was even 20 years ago.
Oh, wow. Okay.
Yeah, it's more and more common. So write that one down. I mean, I'm sure you had your cholesterol checked,
Oh, yeah.
triglycerides, and your HDL.
Yes.
The LP little a in your case is very, very important.
With the COVID-19, there are certain things that a lot of people are really stressing out about, risk factors as far as, people at home that are constantly locked up. They can't go anywhere because of this. What precautions do people need to do with pre-existing heart problems need to take during this COVID?
They just need to be a little bit cautious. I mean, I worry about diabetes the most, especially if you're overweight. And the COVID has really sorted this one out because if you look at, the death situation, if you're an overweight diabetic or a type 2 diabetic, that's crucial because remember this, the inflammatory cytokines, these inflammatory messages, so to speak, they live in fat cells. So, the COVID-19, a lot of, let's call it a cytokine storm where, the virus attacks the immune system and all of a sudden you get bleeding and blood clotting. And it's a mess. It's a total mess. But one of the reasons why I think overweight diabetics are affected more is because they have more of these inflammatory mediators in the body, almost like a magnet, drawing, different metals together. And, when you have more substrate to interact, well, that could be problematic.
Mm.
So, I tell most people, I said, geez, if you're 5 or 10 pounds overweight and you have borderline blood sugars, the best thing you can do is just lose some weight, take away these inflammatory mediators, reduce your blood sugar. I like the fact that people get exercise and riding bikes more and walking more. That helps. I like a non-inflammatory diet, and that means less sugar. I think sugar is the worst thing you can put into your body during this COVID-19, because what sugar does, it sort of squelches, or it makes white blood cells lazy. You know what I mean?
Yeah, yeah,
it
definitely.
takes away their aggressive activity, so to speak. So there's simple things people can do during this whole epidemic that can really, be significant.
Okay. Now, I've talked to other pharmacists, and I just spoke to a doctor that was in England, and she had recommended basically, the gut health are key. No sugars. A lot of them are saying this exact same thing. So I guess my question is there anything else that you're recommending that you haven't heard from others? I mean, I see the supplements, the exercise, the trying to reduce stress and things along those lines. Even medications and like those supplements are really key right now, along with diet. Is there other things that you're recommending that we're not seeing across the board?
Yeah. Oh, yeah. I mean, are you familiar with earthing or grounding or anything? Putting your bare feet on the ground on Mother Earth?
No.
Yeah.
Oh.
We wrote that book maybe 10 years ago, but it's been about 25 clinical trials. Small, they're small studies. But basically, we even had some feedback from people who were earthing and grounding, putting their bare feet on the ground, and sometimes you can even sleep with a patch, like an EKG patch over your chest. We had one person write into the website, they put a patch on their chest, and basically they didn't get the clotting or the blood leakage into the lung. It was an anecdotal report, but basically it was real, So the research on grounding and earthing is amazing, and I'll tell you the most important thing, Bill, that I've seen, and the most important paper I think I've ever written my entire life, because I've been a doctor for almost 50 years, is that when you put your bare feet on the ground, you thin the blood, and most people like yourself get heart disease because of hypercoagulable blood. In other words, if the blood is like red ketchup, it clots more, it sticks more, it forms more plaque. But if the blood is more like red wine and it flows more, the blood gets delivered to the tissues. And there's higher oxygenation. And that's what earthing and grounding does. It makes the blood thinner. And we showed that in clinical experiments. And I got to tell you, I've written a lot of papers. I've done a lot of research in my life. I mean, other doctors have done much more than me, but I've done my fair share as a clinician. And I got to tell you, when I discovered that earthing and grounding has a remarkable effect on changing the hemodynamics of the blood, I thought it was the greatest discovery I've ever discovered in 50 years of medicine. I was talking to other scientists in Sweden, and they were telling me this is Nobel Prize material, blah, blah, blah. Do you know I couldn't get that published in 9 journals?
Wow.
I'll tell you, it was, and I'm a reviewer for journals. I mean, I review other people's work, and I'm saying to myself, if I can't get this published, this was awful. But I got to tell you, one of the journals finally took it. But I think that when people put their bare feet on the ground, it has a remarkable soothing influence on not only the cardiovascular system but the hormonal system as well. Are you familiar with fight, flight, parasympathetic, sympathetic, discharge? Like they used to call it, meeting a saber-toothed tiger, and you go on, automatic, and you're outpouring adrenaline and stuff like that.
Yeah.
Well, what grounding does, it balances that sympathetic over discharge of adrenaline with the parasympathetic system. So grounding does a lot of good stuff, and even in this epidemic, I'm telling people that if you want to walk on the beach, and the beaches are opening up in Florida, thank God.
Yeah.
If you want to walk on grass or concrete or brick, that's great. But it has to be natural, like sand, brick, even concrete is natural, But anyway, I think grounding could make a difference in some of these people as well.
Okay. Well, that's a very interesting theory. Now, is it because of the? I know there's a lot of things out there like these copper things and magnets and and all of this stuff. Is that kind of along those lines?
No, it's different than that. You see, there's an energy to the earth. We call it the Schumann Resonance. SCHUMANN, I believe. And you can actually Google that. And the Schumann Resonance is sort of a buzzing or a humming of the earth.
Okay.
And basically, it comes from. Actually, you live in Arizona, so you don't probably get a lot of lightning storms there, do you?
Not typically. We do have some lightning during like the monsoon seasons, but
yeah. But when lightning strikes the earth, now I live in the Tampa area, and that's sort of one of the lightning capitals of the world.
Yes.
But when the lightning strikes the earth, the earth is getting charged with a lot of electrons because it's electricity.
Mm-hmm.
And if you walk outside after a thunderstorm, and you smell that ozone and everything, and you're walking grounded, and you're walking in your bare feet, suppose you're on grass or concrete or the sandy beach, you'll be absorbing, millions and millions and millions of electrons through your feet. In other words, through contact with the earth. And when you absorb these electrons, it's like taking handfuls of antioxidants, like vitamins, minerals, CoQ10, all that stuff, So, grounding brings a lot to the table because it's a natural phenomena. So some of the writers who have written books with us and papers, like Marty Zucker, he calls it vitamin G. He calls it vitamin G for the ground, like vitamin D for the sun, and stuff like that. So, you probably haven't heard about earthing and grounding, although there's lots of movies on it. If you just Google it, Google earthing and grounding, and see what comes up. You'll learn a lot, Bill. It'll be good for you.
Yeah. I'm going to do that. So what should people who are generally healthy do now to improve their health during this immunity with this COVID era that we're now living in with all the social distancing? I noticed that you said earlier you see a lot more people riding bikes and going for walks, and we've seen that here too. But we have a lake, and a lot of people are still coming to the lake and and going out on their boats and stuff. And but is there something as a cardiologist that you're recommending for people to do more of that they typically wouldn't be doing during a situation like this?
Well, I've already mentioned less sugar in the diet. We've already mentioned walking and exercise. I think these are very crucial because, again, and weight loss. I mean, that would be the perfect trifecta. If you can, lose 5 or 10 pounds, lower your blood sugar, getting vitamin D in the sun. So if anybody's walking out or riding bikes in Arizona, I think that's incredible because vitamin D brings a lot to the table. And then, we didn't talk about targeted nutritional supplements, but I think there's a lot of supplements out there that can support the immune system. It's almost like, you've heard about resveratrol, right? You can get it in red wine or grape juice and stuff like that.
Yeah.
But resveratrol as a supplement, it brings a lot to the table because it helps to prevent virus replication. And, whenever you can prevent that from any virus, that helps. You've heard of curcumin, right?
Curcumin?
Yeah. It's sort of the spice they use in India, that yellow spice.
Oh, yes. Yep.
Yeah,
there's been
curcumin.
a lot of studies on that, too.
I love curcumin and resveratrol together. They're really supportive for the brain. It's just, and there's such a synergistic component with both of those. And curcumin, helps the immune system as well. There's another supplement I really like. It's called NAC, capital NAC. We pronounce it NAC. And what it does, Bill, it's called N-acetylcysteine. It's like an amino acid complex. But you can take it as a supplement. It's inexpensive. You can get it in any health food store. And it's a building block for what we call glutathione in the body. And the glutathione that is in our bodies is the most important immune-supporting antioxidant we have. So you mentioned vitamin C, right?
Yes.
If you take N-acetylcysteine, NAC, and you take vitamin C and you take a little selenium, that's a mineral, those are all the building blocks for the most supporting antioxidant complex in the body, and we call that glutathione peroxidase. And if you can build these natural stores by taking selenium, vitamin C, and NAC or NAC, that will help your immune system remarkably. Now, they've done studies just on NAC alone in flu-like illnesses, and NAC, just by taking like 600 to 1,200 milligrams a day, can shorten an influenza-like illness by 2 or 3 days.
Wow.
They've done nice clinical research on that. So I got to believe that, if people, wanted to take NAC, it's so harmless. There's no downside. I see no downside to taking, an additional vitamin C or vitamin D or selenium. I see no downside at all. And if it could help the overall immune response, I would do it, There's one more supplement that I take personally that, maybe, I don't know if you've heard about it. I heard about it 2 years ago. Actually, I was at an American College of Nutrition conference. We have our conference once a year. And there was a neurologist from California who was talking about it. And he sort of like stroked my imagination. It's called capital AHCC. It's a mushroom type of complex. But what it does with these multiple like mushrooms in it, it supports what we call natural killer cell activity in the body. In other words, it makes our white cells, like our killer cells, kind of angry. And one of the pro-inflammatory mediators in the body is what we call, forgive me for being scientific, it's called NF-kappa B. But it's sort of like this capital AHCC is an NF-kappa B inhibitor. So in other words, it cuts down on the inflammation in the body. And during this epidemic, personally, I take one of these capsules every day, like brushing my teeth,
And what's it called again?
It's called capital AHCC. If you Google it, you'll probably find it on the internet.
Okay.
It's and I like that, and the vitamin C I take, and I have no connection to any of these companies financially at all. This is what I personally do. The vitamin C I take is a liposomal varietal. It's 1,000 milligrams. It's sort of a package, and you squeeze it, put it underneath your tongue, and I really like that.
Okay.
I like that as well. So, this COVID-19, it doesn't have to be rocket science. It's simple. It's less sugar in a diet, more walking, more bicycle riding, more vitamin D from the sun, more grounding, more targeted nutritional supplements, healthier eating. It's so simple.
Yes.
But you see, you got to have your immune system ready for this. Like we were both athletes. You played football, right?
Yes.
You told me. Yeah, I was a Division I wrestler from. I wrestled all through junior high, high school, and college. And when we prepared for athletic endeavors, we got ourselves in shape mentally, physically, and stuff like that. And getting prepared for this COVID-19 is like an athlete, ready to go into combat, so to speak.
Yeah.
You have to get ready. You have to be, you were in shape. Remember in football, if you weren't in shape and you were
the 2 days were a pain.
Yeah, and you were looking. Yeah. I played football in high school. I remember we had triple sessions. In the summertime.
Wow! Yeah,
triple.
Yeah,
our coaches were nuts. Oh God! But anyway, those were the good old days,
Yes, they were. Yeah, they were. I miss them sometimes, actually.
Yeah. So anyway, personally, I would get your LP(a) checked. That's very important to you. And if your doctor does cholesterol fractionization, that's important. One of my good books on this, it's 10 years old, but I wrote it with another board-certified cardiologist. It's called reverse heart disease now. And back then, we were even talking about vitamin K2. I really like vitamin K2. And there's more and more literature coming out that this is effective against COVID-19 as well. But vitamin K2 is, it's not like K1 that's involved in blood clotting. But what vitamin K2 does, it takes calcium out of blood vessels where it doesn't belong, and it puts it back in bones where it does belong. And if you can, just research vitamin K2. It's called metaquinone 7.
Okay.
And there's more and more papers coming out that this is sort of exciting in the COVID-19 as well. So for a guy like you who already has, coronary atherosclerosis, when I met these Dutch researchers, I met them at Yale University 15 years ago. I've been taking vitamin K2 every day since I met them when they discussed their research with me. They're both from the Netherlands. They spent their whole lifetime studying this vitamin K2, which is not involved like K1 in blood clotting. It's totally different. But for a guy like you with early coronary disease, I would definitely take it.
Okay.
And the dose would be 150 mcgs a day. We have it at Healthy Directions, if you want to get it. But you can go to any health food store and get vitamin K2. But make sure it's metaquinone 7. Don't take metaquinone 4. It's a lot less expensive, but it's not as effective
Okay.
as MK7.
All right. Wow. Thank you so much for all the info. I really appreciate it.
All right. Well, God bless, and have a great day.
And you as well. And thank you again for the information and your time. We really appreciate it.
All right.